More than 600 days of protesting and still no change. Blocking traffic, desperate to be heard. Even after the deadly pandemic, the state of healthcare in this part of rural Bihar remains in shambles.
COVID was so bad that people were dying like stray dogs. There were no facilities. Private doctors had fled. We were told to take the patient home. There was no treatment available.
3 years ago, COVID brought the world to its knees. India's healthcare system was pushed way beyond capacity. An unimaginable number of dead. Kuseswar Pathak's grief is only bearable when praying. He blames himself for Sudha's death.
She was my wife. Protecting her was my responsibility. What can I say? If a doctor saw her, if she had oxygen, she wouldn't have died. This is my trauma.
The feeling here is that no lessons were learned post-COVID. Take a look at these empty, dusty beds. This entire building was meant to be a trauma center, but look, the operating theater, locked. Over here, X-ray machine area, also locked. It has not been working as a trauma center since it was built in 2004. In fact, right now, it's being used partly for primary health care. Moved from the north to India's southern states, and not even Kerala, with its superior healthcare, was spared the wrath of COVID. Since the pandemic, this rural community health center has made significant upgrades: new isolation ward, lab, and revamped outpatient clinic. A noticeable difference in the level of care.
The facilities in the center are good, but some antibiotics are usually unavailable, and this needs to be sorted out.
The waiting times have come down drastically. Other facilities are also available. The infrastructure has also improved.
Such is the divide in India, where parts of the country were able to rebuild, while others could not.
We will keep all of this in mind when we are voting. Whichever political party works on this will get our vote.
The pandemic brought the dire state of healthcare into the spotlight. And even after its devastating impacts, healthcare remains absent as a major issue on the campaign trail. Samira Hussain, BBC News, Bihar.